admissions, transfers, and discharge. The responsibilities of nurses extend beyond the mere physical placement of a patient in a healthcare facility. It involves a comprehensive admission assessment, a critical step that provides essential baseline data for the development of a tailored nursing care plan. The admission assessment serves as a snapshot of the patient's current health status, offering valuable insights into their medical history, current conditions, and potential risks. This information becomes the foundation upon which a personalized care plan is built, ensuring that each patient receives the precise care they need. Furthermore, this initial assessment is not a one-time event. Comparisons with future assessments become pivotal in monitoring the client's ongoing status and their response to treatment. This dynamic approach enables nurses to adapt care plans as needed, ensuring that interventions align with the patient's evolving health needs. However, we must acknowledge that the admission process is not always smooth sailing for patients. Many individuals experience heightened anxiety, fear of the unknown, and a profound sense of loss of independence and self-identity when entering a hospital or healthcare facility. For children, the separation from parents during hospitalization can trigger separation anxiety, adding an extra layer of complexity to the emotional landscape. As nurses, recognizing and addressing these concerns is paramount. By providing respectful, culturally sensitive care, we can significantly enhance our patients' experiences and contribute to positive outcomes. In the realm of transfers, nurses once again play a pivotal role in ensuring a seamless transition of care. Whether it's a move between departments or facilities, effective communication and collaboration are key. Patient information must be transferred accurately, and the receiving team should be well informed about the patient's history, needs, and ongoing care plan. Finally, the discharge process is not merely the conclusion of a patient's stay, but a crucial step in their journey towards recovery or management of their health. Nurses must ensure that patients and their families receive comprehensive education about post-discharge care, including medications, follow-up appointments, and any necessary lifestyle modifications. Nursing considerations for discharge. Planning. Discharge planning is an interprofessional process that starts at admission. Nurses play a vital role in discharge planning by collaborating with clients, families, and other members of the healthcare team to ensure that clients have the resources and support they need to transition smoothly from the hospital to the community. Here are some specific nursing considerations for discharge planning. Assess the client's ability to participate in the admission assessment. Clients who are in distress or who have mental status changes may need to have a family member or other caregiver provide information on their behalf. Begin establishing the therapeutic relationship with the client and family during the admission process. This will help to build trust and rapport, which is essential for effective communication and collaboration. Promote professional communication between providers. Nurses should communicate regularly with the client's physician and other members of the healthcare team to keep them updated on the client's progress and to discuss discharge plans. Use the nursing process as a guide to plan teaching and interventions for the client during discharge. Nurses should assess the client's learning needs and develop a teaching plan that covers topics such as medication management, wound care, and self-care. Nurses should also provide the client with resources and support to help them manage their condition at home. Use standard handoff communication tools such as introduction, situation, background, assessment, recommendation, ISBAR, to facilitate transfers and discharges. ISBAR is a structured communication tool that helps to ensure that all relevant information is communicated accurately and efficiently. Here are some specific examples of nursing interventions that can be used to promote effective discharge planning. Educate the client and family about the discharge planning process. Explain what to expect and how they can participate. Assess the client's needs and resources. This includes identifying any social determinants of health that may impact the client's ability to manage their condition at home. Develop a discharge plan with the client and family. This plan should include specific goals for the client as well as a timeline for achieving those goals. Make referrals to community resources such as home health care, outpatient clinics, and support groups. Coordinate with the client's physician and other members of the healthcare team to ensure that the discharge plan is implemented smoothly. By following these nursing considerations, nurses can help to ensure that clients have a successful transition from the hospital to the community. Admission process. Prior to the arrival of the client, bring the necessary equipment into the room. This should include appropriate documentation forms, equipment to measure vital signs, a pulse oximeter, hospital attire for the client. Procedure. 1. Introduce yourself and identify your role. 2. Explain the roles of other care delivery staff. 3. If in a semi-private room, introduce the client to their roommate. 4. Provide hospital attire and assist as necessary. 5. Position the client comfortably. 6. Apply the identification bracelet and allergy band if needed. 7. Provide facility-specific brochures and informational material. 8. Provide information about advance directives. 9. Document the client's advance directives status in the medical record. Place a copy in the medical record if it is available. Here is an example of how to introduce yourself and identify your role. Hello, my name is Julie and I'm a registered nurse. I'll be your nurse for today. I'm here to help you get settled in and to answer any questions you have. Here is an example of how to explain the roles of other care delivery staff. In addition to me, there are other members of the healthcare team who will be involved in your care. These include doctors, physical therapists, occupational therapists, and pharmacists. Your doctor is responsible for overseeing your care and making decisions about your treatment. The physical therapist will help you with any mobility or movement issues. The occupational therapist will help you with any activities of daily living, such as bathing and dressing. The pharmacist will dispense your medications and answer any questions you have about them. Assessment and data collection for admission. When a client is admitted to a healthcare facility, it is important to assess and collect baseline data. This information will help the healthcare team to understand the client's current health status and to develop a plan of care. Baseline data. Baseline data includes vital signs, temperature, pulse, respirations, blood pressure, height and weight, allergy status, biographical information, name, date of birth, gender, address, contact information. Client's reason for seeking health care, present illness and symptoms, health history, current illness, current medications, prescription and over-the-counter, prior illnesses, chronic diseases, surgeries, previous hospitalizations, other relevant data, family history, hypertension, cancer, heart disease, diabetes, mellitus, psychosocial assessment, alcohol, tobacco, drug, and caffeine use, history of mental illness, history of abuse or homelessness, home situation or significant others, nutrition, current diet, any chewing or swallowing problems, recent weight gain or loss, use of nutritional or herbal supplements, dentures, spiritual health or quality of life concerns, religion, advance directives, living will, review of systems, safety assessments. Safety assessments are also important to conduct during admission. These assessments can help to identify potential risks for falls and injuries. Safety assessments include history of falls, sensory deficits, vision, hearing, use of assistive devices, walker, cane, crutches, wheelchair, discharge information. It is also important to collect discharge information during admission. This information will help the healthcare team to ensure that the client has a smooth transition from the healthcare facility to their home environment. Discharge information includes family members in the home, transportation for discharge, relevant phone numbers, medical equipment needs at home health care needs at home. The healthcare team will use the data collected during admission to develop a plan of care for the client. The plan of care will include goals for the client, as well as interventions to help the client achieve those goals. Tips for collecting data. Here are some tips for collecting data during admission. Be organized and efficient. Use a standard assessment form to ensure that all relevant information is collected. Be clear and concise in your questions. Give the client time to answer your questions. Be respectful of the client's privacy and confidentiality. Document all findings accurately and completely. By following these tips, you can help to ensure that the healthcare team has the information they need to provide the best possible care for the client. Inventorying personal items. When a client is admitted to a healthcare facility, it is important to inventory their personal items. This is done to protect the client's belongings and to ensure that they are returned to the client upon discharge. Items that should be inventoried include clothing, jewelry, money, credit cards, assistive devices, eyeglasses, contacts, hearing aids, cane, dentures, medications, cell phones, and other technology devices. Religious articles, valuables such as money, jewelry, and credit cards should be discouraged from being kept at the bedside. If the client insists on keeping valuables at the bedside, they should be documented as having done so. The nurse should also document communicating with the client about the risks of keeping valuables at the bedside and about the facility's safekeeping policies. If the client chooses to have their valuables stored in the facility's safe, the nurse should document this and provide the client with a receipt for their valuables. The nurse should also document the time and date the valuables were deposited in the safe and the time and date they were retrieved from the safe. Here is an example of how to document communication with the client related to items left within the room and valuables locked in the facility's safe. The client was informed of the risks of keeping valuables at the bedside, including the possibility of loss or theft. The client was also informed of the facility's safekeeping policies and was given the option of having their valuables stored in the safe. The client declined to have their valuables stored in the safe and signed a document acknowledging this decision. The client was provided with a receipt for their valuables that were deposited in the facility's safe on date at time. The client will be notified when their valuables are ready to be retrieved from the safe. Orient the client and family to the room and the facility. This is an example on how to orient the patient. Now let's go over some key points to help you familiarize yourself with the room and the facility. Call light operation. If you need assistance from our staff, please use the call light system. It's a simple button located within easy reach. Pressing it will alert our nursing team, and they will respond promptly to address your needs. Electric bed operation. Your bed is equipped with electric controls to ensure your comfort. If you have any specific preferences or need assistance with adjusting the bed, please let our nursing staff know, and they'll be happy to assist you. Telephone services, television controls. In your room, you'll find a telephone and a television. Feel free to use them at your convenience. If you have any questions about their operation or if you encounter any issues, our staff is here to help. Overhead lighting operation. The overhead lighting in your room can be controlled using the switches located near the entrance. Adjust the lighting to your preference to create a comfortable environment. Smoking policy. Facility name is committed to providing a healthy and smoke-free environment. Smoking is strictly prohibited within the facility. If you need assistance or information about smoking cessation programs, please ask our staff. Restroom locations. Restrooms are conveniently located. Mention specific locations, such as in each patient room or nearby. If you require any assistance locating them, feel free to ask our staff for guidance. Waiting areas. We have designated waiting areas for your family and friends. These areas are designed to provide a comfortable space for them while ensuring your privacy and well-being. Meal times. Our meal service is an important aspect of your care. Regular meal times are mentioned specific times, and our dietary staff will be happy to accommodate any dietary restrictions or preferences you may have. Usual time for providers' visits. Your healthcare providers will typically make rounds at mentioned specific times. If you have any questions or specific topics you'd like to discuss with them, please inform our nursing staff. Dining, vending services. We offer dining services, and there are vending options available for snacks. Please refer to the information provided in your room for more details on dining options and their operating hours. Visiting policies. We understand the importance of having loved ones by your side. Our visiting policies are designed to balance the need for support with the necessary rest and recovery of our patients. Please check with our staff regarding specific visiting hours and any special considerations. We want you to feel at home during your stay at facility name. Our staff is here to assist you every step of the way. If you have any questions or need further clarification on any of the points discussed, please don't hesitate to ask. Indications for transfer and discharge in healthcare. Why might a patient need to be transferred or discharged? There are several reasons, and they are often tied to the evolving needs of the patient and the level of care required. Let's explore these indications in detail. The first indication for transfer or discharge is a change in the level of care needed. For instance, if a patient's health status improves to the point where they no longer require intensive care, it may be appropriate to consider transferring them to a lower level of care. This is a positive outcome that reflects the effectiveness of the medical interventions provided. Sometimes, a change in the patient's condition necessitates a move to a different setting. This could be the case when a patient is transferred from a medical unit to a surgical suite. Different settings offer varying levels of specialization and resources, ensuring that the patient receives the most appropriate care for their current needs. Another crucial reason for transfer or discharge is when the facility is unable to provide the specific type of care that a patient now requires. For example, after the acute phase of a stroke, a patient may need specialized care that the current facility cannot offer. In such cases, a transfer to a facility equipped to handle the patient's evolving needs becomes necessary. Finally, patients who no longer need inpatient care and are deemed ready for a return home represent another common indication for discharge. This often occurs when the patient has reached a point in their recovery where they can continue their treatment and rehabilitation in a home setting with appropriate support and follow-up care. Discharge planning. Discharge planning is a systematic process that begins upon admission and aims to prepare the patient for a safe return to their home environment. It involves a series of assessments, considerations, and actions to guarantee the well-being of the patient post-discharge. The first step in discharge planning is to assess whether the patient will be able to return to their previous residence. This includes evaluating the safety and suitability of the home environment for the patient's recovery. Additionally, determine if the patient needs assistance at home and assess the need for any adaptations or specific equipment. To address the broader social aspects, a crucial step is making a referral to the social worker. The social worker plays a key role in arranging community services that can support the patient in their post-discharge period. This may include home health services, meal delivery, or other community-based programs. Effective communication with community service providers is paramount. Health status and specific needs of the patient should be clearly conveyed to ensure a coordinated and supportive network upon discharge. This collaboration ensures continuity of care beyond the healthcare facility. While discharge planning progresses, it is important to remember that a patient, if legally competent, has the right to leave the facility at any time. In such cases, the nurse is responsible for notifying the patient's provider, obtaining necessary signatures, and providing discharge teaching. In every step of the discharge planning process, it is crucial to involve the patient and their family as much as possible. This collaborative approach not only enhances the patient's understanding of their care plan, but also promotes a sense of empowerment and responsibility. Discharge education. The nurse discusses the discharge instructions with the client and provides a printed copy. Instructions should use clear, concise language that the client will understand. The nurse should verify understanding of the instructions by the client. Standards for discharge education. 1. Identifying safety concerns at home. 2. Reviewing symptoms of potential complications and when to contact emergency care or the provider. 3. Providing the phone number of the provider. 4. Providing names and phone numbers of community resources that give care at the client's residence. 5. Step-by-step instructions for performing continuing treatments, such as dressing changes. 6. Dietary restrictions and guidelines, including those that pertain to medication administration. 7. Amount and frequency of therapies to perform to support continued independence at home. 8. Directions how to take medications, potential interactions, and why adherence is important. Equipment items to transfer or discharge with the client. When transferring or discharging a client from a healthcare facility, it is important to ensure that the client has all of the necessary equipment items. These items may include personal belongings at the bedside and from dresser drawers and closet, flowers, books, clothing, personal care items, valuables from the safe, if leaving the facility, medications, especially that belong to the client or that cannot be returned to the pharmacy for credit, assistive devices, medical records, or a transfer form. Personal belongings should be packed in a suitcase or bag that the client can easily carry or transport. Items to pack include clothing, personal care items, and any other items that the client may need during their transfer or discharge. If the client has any valuables, such as money, jewelry, or credit cards, these items should be retrieved from the safe and given to the client. All medications should be transferred with the client. This includes prescription medications, over-the-counter medications, and herbal supplements. Medications that belong to the client or that cannot be returned to the pharmacy for credit should be transferred in their original containers. Responsibilities of the nurse transferring or discharging a client. 1. On the day and time of transfer, confirm that the receiving facility or unit is expecting the client and that the room or bed is available. This is important to ensure that the client has a smooth transition to their new care setting. The nurse can confirm this information by calling the receiving facility or unit and speaking with a staff member. 2. Communicate the time the client will transfer to the receiving facility or unit. This information is important for both the client and the receiving facility or unit. The client needs to know when they will be transferring so that they can be prepared. The receiving facility or unit needs to know when to expect the client so that they can staff appropriately. 3. Complete documentation, medical records transfer form. Accurate and complete documentation is essential for the continuity of care. The nurse should complete all necessary documentation, including the client's medical records and a transfer form. The transfer form should include information such as the client's name, date of birth, medical history, current medications, and any special needs. 4. Give a verbal transfer report in person or via telephone. A verbal transfer report is a communication between the nurse transferring the client and the nurse receiving the client. The verbal transfer report should include information such as the client's medical history, current medications, allergies, any special needs, and the client's current condition. 5. Confirm the mode of transportation the client will use to complete the transfer or discharge, car, wheelchair, or ambulance. The nurse needs to confirm the mode of transportation the client will be using to ensure that the transfer is safe and efficient. If the client is going to be transported by car, the nurse needs to make sure that the client is dressed appropriately and that they have a safe way to get to the car. If the client is going to be transported by wheelchair, the nurse needs to make sure that the wheelchair is in good condition and that the client is able to use it safely. If the client is going to be transported by ambulance, the nurse needs to contact the ambulance company and schedule a pickup time. 6. Make sure the client is dressed appropriately if going outside the facility. The nurse needs to make sure that the client is dressed appropriately if they are going to be going outside the facility. The client should be dressed in comfortable and weather-appropriate clothing. The client should also wear shoes that are comfortable and supportive. 7. Account for all the client's valuables. The nurse needs to account for all the client's valuables before they are transferred or discharged. This includes money, jewelry, credit cards, and other personal belongings. The nurse can account for the client's valuables by asking the client to verify that they have all of their belongings and by checking the client's room and belongings. By following these responsibilities, nurses can help to ensure that the transfer or discharge process is safe and efficient for the client. Responsibilities of the nurse when receiving a transferred client. 1. Have any specialized equipment ready. If the transferred client will be using specialized equipment, such as a ventilator or a dialysis machine, the nurse should have this equipment ready before the client arrives. This will help to ensure that the client's transfer is smooth and that they receive the care they need immediately. 2. If appropriate, inform the client's roommate of the impending admission or transfer. If the transferred client is going to be sharing a room with another client, the nurse should inform the other client of the impending admission or transfer. This will help to prepare the other client for the new roommate and to avoid any surprises. 3. Inform other healthcare team members of the client's arrival and needs. The nurse should inform other healthcare team members, such as the doctor and the respiratory therapist, of the client's arrival and needs. This will help to ensure that the client receives the care they need from all members of the healthcare team. 4. Meet with the client and family on arrival to complete the admission process and orient the client and family to the new facility or unit. The nurse should meet with the transferred client and their family on arrival to complete the admission process and to orient them to the new facility or unit. This includes reviewing the client's medical history, current medications, and allergies. The nurse should also answer any questions that the client or their family may have. 5. Assess how the client tolerates the transfer. The nurse should assess how the client tolerates the transfer. This includes assessing the client's vital signs, respiratory status, and level of consciousness. The nurse should also assess the client for any signs of distress or discomfort. 6. Review transfer documentation. The nurse should review the transfer documentation to ensure that all necessary information is included. This information should include the client's medical history, current medications, allergies, and any special needs. 7. Implement appropriate nursing interventions in a timely manner. The nurse should implement appropriate nursing interventions in a timely manner. This may include administering medications, providing wound care, or monitoring the client's vital signs. By following these steps, nurses can help to ensure that transferred clients receive the care they need in a safe and efficient manner. Transfer documentation. Transfer documentation is a critical part of the patient care process. It is important to ensure that all relevant information is transferred to the receiving facility or unit so that the patient can receive safe and effective care. The following information should be included in transfer documentation. 1. Medical diagnosis and care providers. This information includes the patient's primary diagnosis, any secondary diagnoses, and the names of their care providers. 2. Demographic information. This information includes the patient's name, date of birth, gender, address, and phone number. 3. Overview of health status, plan of care, and recent progress. This information should include a summary of the patient's current health status, their plan of care, and their recent progress. 4. Alterations that can precipitate an immediate concern. This information should include any changes in the patient's condition that could lead to an immediate concern, such as a change in vital signs, respiratory status, or level of consciousness. 5. Notification of assessments or care essential within the next few hours. This information should include any assessments or care that are essential for the patient's safety and well-being within the next few hours, such as medication administration or wound care. 6. Most recent vital signs and medications, including PRN. This information should include the patient's most recent vital signs and a list of all the medications they are currently taking, including PRN as needed medications. 7. Allergies. This information should include a list of all of the patient's known allergies. 8. Diet and activity orders. This information should include the patient's current diet and activity orders. 9. Specific equipment or adaptive devices, oxygen, suction, wheelchair. This information should include a list of any specific equipment or adaptive devices that the patient needs. 10. Advance directives and emergency code status. This information should include the patient's advance directives, if any, and their emergency code status. 11. Family involvement in care and healthcare proxy, if applicable. This information should include the names and contact information of the patient's family members who are involved in their care, as well as the name and contact information of their healthcare proxy, if applicable. It is important to note that this is just a general list of the information that should be included in transfer documentation. The specific information that is needed may vary depending on the patient's individual circumstances. Here are some tips for completing transfer documentation. Be clear and concise. Use complete sentences and proper grammar. Avoid using abbreviations or acronyms that the receiving facility or unit may not understand. Document all relevant information, even if it seems insignificant. Sign and date the transfer documentation. By following these tips, you can help to ensure that your transfer documentation is complete and accurate. This will help to ensure that the patient receives safe and effective care at the receiving facility or unit. Discharge documentation. Discharge documentation is an important part of the patient care process. It provides a summary of the patient's hospitalization and provides instructions for their care after discharge. The following information should be included in discharge documentation. 1. Type of discharge, provider prescription, or against medical advice. AMA. This information indicates whether the patient was discharged with the provider's approval or if they left the hospital against medical advice. 2. Date and time of discharge, who went with the client, and transportation, wheelchair to car, gurney to ambulance. This information includes the date and time the patient was discharged, the name of the person who went with them, and the mode of transportation they used to leave the hospital. 3. Where the client went, home, long-term care facility. This information indicates where the patient went after they were discharged from the hospital. 4. Summary of the client's condition at discharge: steady gait, ambulating independently, in no apparent distress. This information provides a summary of the patient's condition at the time of discharge, including their mobility, level of consciousness, and overall condition. 5. Description of any unresolved difficulties and procedures for follow-up. This information describes any unresolved difficulties that the patient is still experiencing at the time of discharge, as well as the procedures for follow-up care. 6. Disposition of valuables, medications brought from home, and prescriptions. This information indicates how the patient's valuables, medications brought from home, and prescriptions were handled at the time of discharge. It is important to note that this is just a general list of the information that should be included in discharge documentation. The specific information that is needed may vary depending on the patient's individual circumstances. Discharge instructions. Discharge instructions are an important part of the patient care process. They provide patients with the information they need to manage their care after they leave the hospital. It is important to document that the patient understands their discharge instructions before they are discharged. There are a few different ways to document a patient's understanding of their discharge instructions. One way is to simply ask the patient to repeat back the instructions to you. Another way is to have the patient fill out a questionnaire about the instructions. You can also use a teach-back method, where you have the patient demonstrate how they will perform a task, such as administering medication or changing a dressing. Here are some specific things to document. 1. Written instructions in the client's language. Provide the patient with written instructions in their language. This will help them to remember the instructions after they leave the hospital. Diet at home. Explain the patient's diet at home, including any restrictions or special instructions. 2. Step-by-step instructions for procedures at home. Provide the patient with step-by-step instructions for any procedures they will need to perform at home, such as administering medication or changing a dressing. Be sure to demonstrate the procedures to the patient and have them practice. 3. Precautions to take when performing procedures or administering medications. Explain any precautions the patient needs to take when performing procedures or administering medications. For example, the patient may need to wear gloves or wash their hands before and after performing a procedure. 4. Signs and symptoms of complications to report. Explain the signs and symptoms of complications that the patient should report to their doctor. For example, the patient may need to report any fever, redness, or swelling at the site of an incision. 5. Names and numbers of providers and community services to contact. Provide the patient with the names and numbers of their providers and community services that they can contact if they have any questions or concerns. 6. Plans for follow-up care and therapies. Explain the patient's plans for follow-up care and therapies. For example, the patient may need to see their doctor in 1 week for a wound check or start physical therapy to help them regain their strength. By documenting the patient's understanding of their discharge instructions, you can help to ensure that they receive safe and effective care after they leave the hospital. Here is an example of how to document the patient's understanding of their discharge instructions. Documentation of understanding of discharge instructions. Patient name, John Smith. Date, 2023-08-05. I have reviewed the discharge instructions with Mr. Smith. He was able to repeat back the instructions accurately and demonstrate how he will perform the following procedures at home. Administering pain medication. Changing his dressing. I have also explained the signs and symptoms of complications to report, as well as the names and numbers of his providers and community services. Mr. Smith has expressed that he understands and agrees to follow all of his discharge instructions. Signature, Nurse Jane Doe. Date, 2023-0805. Thank you for listening to my audio notes on nursing. I hope you found them informative and helpful. If you did, please consider subscribing to my channel for more audio notes on a variety of nursing topics.